boy, um, I want to say the beginning of last year. Is that correct, Carrie? It had its sort of birth at one of our advisory group committee meetings, and basically this was something that came up that we thought would be extremely helpful to really provide a tool to connect the county behavioral health departments and our colleges, because of course with this particular funding, it comes from the counties through CalMesa. As you can see at the bottom, that's the source of the funding that provides all these wonderful resources. And we really feel like, well, first of all, it's one of our outcomes of our project was to help and, get that connection made. And ironically, I'm the one doing the intro, but all of the work and effort that went into this goes to other people, including a few who will be on this call, and it was Sally, Janine, a bunch of other people contributed to this product, including a great work group from county mental health and our colleges, facilitated by CARS folks, as well as my colleagues Colleen Ammerman and Heather McClenahan. So we're really excited about this because I think it's a much-needed tool, and as I mentioned at the beginning, we're hoping to be able to have more opportunities to share this and actually put it into practice. So I think with that, I will stop talking and turn it back over to Carrie.
Great, thanks, Betsy. And I'm actually going to go ahead and just pass this right to Sally Ju, who can go ahead and introduce herself and get started with the presentation. And Sally, if you are on mute, you might have to press *6.
Ah, okay. All right, so I can advance the slides now, Carrie?
Yes, you should be able to use the arrow keys on your keyboard.
Okay. Oh, nothing happened.
Okay, I can do it for you.
Okay, so next slide. All right, so welcome everyone to our webinar. My name is Sally Ju, and I'm a social worker who has been working with connecting the various community colleges with their local mental or behavioral health departments for the student mental health program. And Sandy and Janine, would you like to briefly just introduce yourselves, what you do, at where you work? Sandra, you want to go first?
I'm here. Hi, this is Sandra Rowe. I'm a psychologist at Santa Monica College. I oversee the psychological services department here at the college. And for those of you who may not know about Santa Monica College, we have about 34,000 students that we serve in the Los Angeles County area. And we have a staff of 2 full-time psychologists and 5 interns, 3 of which are full-time postdoctoral interns and 2 are part-time predoctoral interns.
Great. Thank you, Sandra. Janine?
Hi, everyone. My name is Janine Moore. I am the Prevention and Early Intervention Manager with Riverside County Department of Mental Health. We have a prevention and early intervention plan that is inclusive of about 30-plus evidence-based and evidence-informed programs, many of which are available to students at our community colleges.
All right, great. Thank you. Next slide. All right, so as Betsy mentioned, there were several people that were instrumental in the creation of the toolkit. First and foremost, the California Community College's Chancellor's Office. And we also have Betsy Sheldon on the call from the Foundation for, Colleen Ammerman from the Foundation for California Community Colleges. They were very instrumental in hosting and setting up the committee that met to talk about what should go into the toolkit. California Community College's Student Mental Health Program, which engineered the execution of the toolkit, and all the great folks who met in June of last year on the toolkit ad hoc committee, and of course the Chancellor's Office Advisory Group on Student Mental Health, which is where the idea originated. Next slide, please. All right, so the objectives for the webinar today is to just give you the context and the purpose of the toolkit. We will briefly go over the main toolkit components, and as we go through the various components, I'm going to ask Sandy and Janine to talk about their experiences in executing best practices as it relates to each component of making that connection between community colleges and county mental or behavioral health departments and building that collaboration. Next. So the context for the toolkit came about because Cal Mesa and the RAND Corporation's research in 2013 found that when they compared California community college students with their UC and CSU counterparts, they found that California community college students had higher rates of impaired academic performance because of mental health issues, that California community college students received less information from their campuses about mental health and wellness. They received fewer mental health referrals, and of the referrals they received, only half the students followed up in any way, shape, or form. And most community college students had to be referred to community health resources because their campuses didn't have any services at all or the types of services that their students needed. Next. So the purpose of the Student Mental Health Program was to increase the college's ability to better address their students' mental health needs by providing technical assistance for mental health prevention and early intervention services located on campus, and also assisting colleges and their county behavioral and mental health departments in building sustainable partnerships that would better link students to local community health resources. Next. So in the work that I did with the community colleges over the last almost 2 years, and in polling both community college staff and different representatives from county behavioral and mental health departments, we found that these were the primary challenges that they identified in building some sort of sustainable collaboration. One for the colleges was finding affordable and accessible local mental health resources for their students. For both parties, finding the right contact person in the county mental health or behavioral health systems or the right contact person in the community college system was a challenge, in part because every county sets up its mental health or behavioral health departments in a different way, and the same is true for every community college and the district in which it sits. And because we know that everybody, whether you are a county employee or a community college employee, is very, very busy, finding time to build a collaboration, figure out who to talk to, win them over, and build something sustainable, often competed with other daily job priorities. And the other issue that came up was staff turnover. If you built a relationship with somebody and they left and there was no succession plan, and your relationship was primarily with that one person rather than a group of people in the organization or the organization itself, then some collaborations fell apart whenever there was staff turnover. limited time and resources. I think that's something we all struggle with. And interestingly, not getting a response or what people defined as a timely response, in which case people just assumed that party wasn't interested and they gave up and moved on. Next. So given all of those challenges, the Chancellor's Office Advisory Group on Student Mental Health, when we made a presentation about these challenges at one of their meetings, and I think that was the January meeting, they decided that it would be helpful to poll those that created successful collaborations to find out what worked, and to take those best practices and put them into a user-friendly toolkit that others could use and adapt their best practices for whatever worked best in those communities. So the toolkit's purpose was to highlight those best practices and then provide guidance for community college and county staff to effectively figure out how to navigate community college and behavioral or mental health department systems to find the right person to set up that collaboration with and to get a better understanding of each other's systems so that they could more effectively link students and follow up with students who did get linked to local services. Next slide. So the target audience for the toolkit were those most likely on the community college side to make student mental health referrals. And that usually was community college academic counselors, health centers, staff, colleges that had mental health service providers, and interns, those folks, and occasionally people that worked in the students with disabilities programs. Our target audience was also people who worked in local county and behavioral mental health departments that could help link students to their services or other non-county services within the community. Knowing that there were unique factors for urban, mid-sized, and rural counties and colleges, we wanted to make sure that we had examples and representatives from all of those types of communities represented in toolkit content. And most importantly, because that's where collaborations begin, is what are the best practices for how to find and connect with the appropriate people in either type of organization. Next. So the toolkit was divided into these 4 major components along with an appendix that has additional resources. There's the pre-collaboration research that we found was really important to do in order to go about this in a more work smart rather than work harder fashion. What went into setting up a successful collaboration, what makes that initial meeting more successful and more likely to lead to additional meetings that would cement that collaboration, and how to set up collaboration infrastructure and other things, other ideas for how to sustain those collaborations over the long term and despite staff changes, funding changes, and any other types of events that came up that could affect both parties. And then, as I said, the appendix with resources. Okay, next slide. So one of the things that we found was critical and enabled people to arrive at the initial meeting more rapidly was to do some sort of research to gain some understanding of mental health issues in your community and a general sense of what kind of resources were available and what kind of resources that you needed. So for both, particularly for the community colleges, if you had a need, is it possible that somebody out there in the community provides it? And if so, would it be your county behavioral and mental health department or possibly someone else? Many people who work in community colleges had no idea how to even begin to navigate their county behavioral or mental health department. Who do you call? Where do I start? I have no idea what all these acronyms mean. I don't know exactly how they set up access, what the eligibility criteria is. So all of that we have put into the toolkit to make it easier for you to navigate. County mental health departments also have funding and are eager to connect with anybody who is in need of their services, and through this program or project, they found that there are lots of people in need of their services going to California community colleges, and many of them have had challenges in trying to understand who to call within the larger community college system. Is it the health center? Is anybody providing any kind of mental health service? What can academic counselors do? Some people may know professors. So where do I start? So again, we have sections in the toolkit that lay out some general tips and basic structures for both entities. Right? And they can help you figure out where to start learning about your respective county mental health departments and community colleges locally. All right, next slide. So in terms of setting up a successful collaboration, once you've done your pre-collaboration research, the first thing you need to do, obviously, is to connect with a potential lead person. So how do you find the appropriate person and prepare for your initial meeting? Because everybody is really busy, all the people that we polled from both organizations said that they were more receptive to people who came to those meetings prepared. So if you're the one initiating the meeting, it helps if you had some idea of not only who you were talking to, but where they sit within their organization. And if you have a clear idea about, for example, if you're a community college person wanting to connect with the county, if you have some idea of what the county mental or behavioral health department services are, their eligibility requirements, which you can easily find online at their sites, and how they tend to organize their services a bit, so that you know what questions to ask, and to set really clear meeting objectives before you go. What is it that you want to happen by the end of the meeting? And based on your desired outcomes, what are some potential mutual benefits and shared goals that you might be able to propose based on your research with that county mental health or behavioral health person? If you are going to a community college from a mental health department, the same process applies. So given that, I'd like to ask our panelists to weigh in. So Sandy, why don't we start with you? How did you find the right folks at the local county mental health department? And since Los Angeles is so big, how did you even know where to begin?
Good question. Thanks, Sally. I have to say that I feel like I started with somewhat of an advantage when I came to Santa Monica College, because I came from community mental health and having worked in the field for many years and having had contact with our local Department of Mental Health. So I knew some names, I knew some people already. And so when I came to Santa Monica College, I really kind of leveraged those folks that I already knew, and decided that I needed to start as close to the top as possible to get buy-in. And I contacted the district chief in our area for our service area in the west side of Los Angeles to just talk about Santa Monica College and what our needs were, and to see if I could have some kind of a meeting to discuss it further. And so I did get, after several calls, I did get a response, and even though I knew this person, it's still hard to really connect with often the people at the higher levels. But I continued to call and was able to get a meeting, and in that meeting is when I talked about more of what our needs were. She talked about what was available and what their needs were, and in the county, and then the district chief connected me with other people who could help implement some kind of collaboration.
Okay, so you were really clear about what you wanted out of that meeting.
Right.
Okay, and you said you kept calling. How long did it take before you were able to actually connect?
It was probably months. Yeah, it was some months before we actually, there was some email exchange in there, but to actually have a meeting, it took probably 2 or 3 months.
Okay. And so what I'm hearing is be patient, be persistent, and keep at it. Okay. All right.
Right.
Great. Thank you. Janine, how did you connect with community colleges? Because I think you initiated a program that they were interested in.
Yes, we did. We, through our local community planning process, one of the programs that our stakeholders were interested in prevention and early intervention dollars funding is called Active Minds, which is a student-run club on college campuses. We were aware that UC Riverside here locally had a chapter, but we were interested in expanding that opportunity for the community colleges. We have several in our county, which actually was fairly new for the Active Minds National Organization to have community colleges have chapters. So we did kind of what was recommended in the toolkit, which was we made cold calls, and we went on the websites and looked for either Dean of Student Services or Disabled Student Services programs, and really just made calls and emails. And I think we were in a position, a favorable position of being able to offer funds. So I think that was attractive to some, but again, not all of the colleges responded. But we did get 4 or 5 in the room at the time. And that really jump-started our relationship with some of the local colleges. One of the things that I think I wanted to highlight here, too, is that although there were some at the time that, for a variety of reasons, I'm sure, didn't respond to our request to meet or our opportunity for funding, we continue to leave that funding opportunity available. And as campuses began putting together their Active Minds Club and really starting to have some real student activity around mental health, their sister colleges then became interested. And so folks from those colleges then would outreach to me and ask if the resource was still available. So we even continue to build those relationships, even I think we're about 5 years down the line.
Oh, that's great. So once again, I'm hearing just because people don't respond doesn't mean that you give up.
Exactly.
Right.
So how did you keep from being discouraged, or what stopped you from giving up? Because a lot of times that's what people do. They just figure people aren't interested, they're too busy, and then you get busy and things just you let it go. So what motivated the two of you to keep at it? Because it sounds like that's what enabled you to build these really successful long-term collaborations.
I think this is Sandy, and I think from my perspective, our need here at the college is huge. And so in order for us to help provide the services that our students need, I really needed to have some collaboration. And so it just was out of sheer desperation sometimes. But I really felt like the students, we needed more. Our students needed a lot of services, and that we could not provide those services on our campus. And so it was just continuing the effort. And it wasn't that I wasn't getting a response at all. It was just that the responses would be intermittent, or schedules would change, or would maybe schedule something and then something would come up. It's just difficult because everybody's busy.
Mm-hmm.
But I felt the county was interested. It was just the connection.
Okay. And do you want to share what you ultimately did get from the county?
In terms of the relationship?
Mm-hmm. And, you want to say a little bit about what services they provide for your staff, for Toya?
Okay. So I feel like it was, we get a lot of services at this point. We have an ongoing relationship now with our DMH navigator. I'm not sure if everybody knows what that means.
Probably not. So let me just make a quick aside here. LA County is so huge, as Sandy alluded to earlier. The county mental health department, and here it's still called a mental health department as opposed to behavioral health. They divided LA County into what they call service area districts, and each one has a district chief, as Sandra alluded to. And each area also has what they call a client navigator, whose sole job is to link people to the services. And that's the person that Sandy's referring to.
Mm-hmm. So the navigator we have ongoing contact with. So, for example, if we have a student that we feel really needs some ongoing services, or need some specific kinds of services, needs psychiatric consultation perhaps, because we don't have a psychiatrist, then we can call our navigator, Toya, and she actually will come to our campus and meet with the student and then set up an arrangement where she then works with that student, and sort of case manages and makes sure that the student gets their needs met. She will often go with meet the student at a particular agency. She'll find the right resource. She'll go with them or meet them there, help them through the process, and then report back to us so that we have the information that now the student is connected. And she's available anytime, pretty much. And we call on her on a regular basis. So that's been a wonderful resource for us. We also have some fairly regular contact with the emergency outreach department, and if we need the psychiatric emergency team. If we need to hospitalize a student, the PET team will come to our campus. We don't have to do that often, and often our campus police can handle that, but sometimes we need assistance with that. And I think also under emergency outreach is the START team, which is the student threat assessment, school threat assessment and response team. So this, which is START. So this is a team of a combination of mental health, Department of Mental Health folks and LAPD that work together around threats and threat assessments on college campuses. And we had a shooting on our campus, so we became very familiar with the START team, and we continue to work with them around students that we see on our behavioral intervention team as maybe possibly having, some kind of threat. So those are kind of the ongoing relationships that we have with the Department of Mental Health. We have other relationships with other agencies as well. And I can talk about that now or another time. Sally, you can decide.
Okay. Why don't we talk about that in a bit? And Janine, do you want to talk about what kinds of relationships and collaborations you have? You've mentioned Active Minds. Are there other things as well that you do with the community colleges?
Well, there are. I just wanted to briefly just go back to your initial question, is why we kept trying. We in the mental health field are incredibly aware of the risk associated with students entering college. And between our community's voice and awareness of that risk for those students, we couldn't stop trying. And just as Sandy said, we knew that it wasn't a lack of interest. It was timing and, waiting for this priority to rise to the top. So having said that, I do have the pleasure of sitting on the Chancellor's Office Mental Health Advisory Board, which Betsy runs, which keeps our county very involved at that kind of higher level. Locally, we continue to be invited to participate on the college campuses for offering trainings to their staff. Any health fairs, we have become a natural invitation and partner with our Family Advocate program, our Peer Support Specialist program, which runs a lot like the Navigator program that Sandy referenced. So just kind of being openly invited on campus as a department has really blossomed. In addition, I think from the work that I do specifically, what has happened is our providers, the prevention and early intervention providers that we fund, have really been welcomed on the campus. We all have a similar goal of providing services to students that meet their needs. So those partnerships have really grown as well, which has been wonderful. One of the things that I've been trying to do, and we may get to this later, I apologize if I'm jumping the gun, is I think we, as a department, and most county mental health departments or behavioral health departments have planning committees or stakeholder meetings. I continue to invite the college representatives to come to those meetings, those ongoing standing meetings, to have a voice and to really build relationships with people other than me. As you mentioned, it's better to have multiple relationships in the organization versus just one. So I continue to try to invite our college partners to those meetings as well.
That's great. All right. And all of you out there, if at any point you have any questions, please feel free to type them into the chat box. We don't need to wait till the very end. All right. Next slide. So Sandy and Janine shared some of their best practices and their experiences in researching, connecting, and then setting up a collaboration and getting that initial meeting and things up and running. And what we found in terms of sustainability and infrastructure, it was really helpful for both parties to clearly define their roles and responsibilities and collaboration guidelines to ensure how they were going to communicate with each other. This was especially helpful when there were staff changes, policy changes, funding changes, funding opportunities, where people might be able to apply for money together, and also accountability. A lot of times when people refer somebody, they want to know what happens, and students sometimes come back and let you know, and sometimes not. And counties also have wanted to know. So we saw the student use the service, and how are they doing? Also, if people have agreed to do certain things and they didn't do them, is the relationship in a place where people can talk about that and resolve any kinds of disagreements or other kinds of issues? We also found that developing infrastructure that supports collaboration, communications, and operations was helpful. And by that I mean, do people formally or informally get together periodically just to talk about how things are going? Do you have a memorandum of understanding between both parties about how referrals are going to be handled, how you're going to get authorization from students to share information across organizations if that's appropriate or necessary? So any of those kinds of infrastructure or support systems I think are really critical, so that there is something to help people when they come in and replace somebody that's left, right? Or if that person is left and is still involved in the community and can help either organization in a different role, how might that person fit into the existing collaboration? And then sharing and trying out ideas for growing and sustaining the collaboration. Some have found that if there's a group of collaborators having a meeting quarterly, looking for different joint funding opportunities, all kinds of things are possible. So, Janine, I'm going to ask you to go first this time. What have you done that's been really effective in sustaining or growing your collaboration with community colleges?
Well, I think a couple of things. One, that old saying, money talks. So funding opportunities that we've been able to put out have helped. So an example is we have a program called Seeking Safety, which is a coping skills program. And so we put out a request for proposal, and Riverside City College actually applied for that and has received the award. So we're really excited that they actually are going to receive funding directly from our department to serve the students on their campus. So, of course, that includes a formal contract that has, terms and conditions, so that require that relationship, which is I'm happy about. In addition,
could you just explain how that works? So would your staff go out and actually provide the Seeking Safety program on campus?
So actually we will be funding Riverside City College to hire staff to do Seeking Safety on their own campus.
Okay.
So yeah.
And you would train them how to do that?
Yes. Oh. The role of my staff is to provide training and technical assistance to any provider. So in this case, it would be employees at the community college that we would make sure that they're trained in the model. We meet with them monthly at a minimum to address any technical assistance needs that they might have, whether that means additional training or just sort of talking through any barriers they're reaching, if there's any assistance we can help. And we also then do live observation of the facilitators doing the program, just to make sure that they have everything they need to implement the program as it's supposed to be implemented. So that will be a very strong partnership with this particular contract. In addition, I'm thinking of one of the colleges that is out in our desert region that I know have regular, I believe it's quarterly meetings that involve our department administration for that region. So all the mental health services out in that region are under the responsibility of one particular administrator. And he meets with the college along with other community providers. And I think this is an ongoing to the grant that they received, where there were meetings that were required, and they found those incredibly valuable and continue to have those meetings. So that's a couple of examples. And then me, I just call whenever I have it on my calendar every couple of months to just make a call to my contacts. And I'm not always able to get them in the moment, but at least they know that I'm interested in continuing that relationship.
Great. And Sandy, before I move into this part for you, a question came in. What are the related student outcomes from the partnerships? For example, is there increased access, retention in services, or how do you know that this actually helps students? And actually, Janine, you might be able to respond to that as well.
So in terms of student outcomes, we're tracking whether students are following through, and with the referral, and we're getting feedback from the department whether students are following through, and so I'm not sure. That's the only thing that we're actually tracking, is if they're actually following through, and after that, it's no longer our client, so we're not tracking after that point. So I'm not sure if we have other specific student outcomes.
And Sandy, do students ever come by and let you know how they're doing, or let your staff know?
That happens. That happens on occasion, but I wouldn't say on a regular basis. Now, if we're working with say we have some issues with a student that we've referred to the START team, which is the threat assessment team, we do get ongoing feedback from them as to, where they are with their work with the student. So, we're able to track that better. But in our office in psychological services, it's difficult for us to really track after we've made the referral and we found out that they are following through on it. We're not able to track after that.
Okay. Janine, do you have any comments about that?
Yeah, we, in a broader sense, we have a research department, and most of our programs, we do outcomes evaluation. So we will have pre and post measures that we use. So, and that's inclusive of any of the programs that are currently being offered on the community college campuses that we fund. Part of the responsibility of that provider is to do the pre-post measures. So we use those to just ensure that we're providing a program that's really making a difference for the people that are involved. We don't break it out to the detail of being able to look at outcomes specifically for only college students, but we just look at the program overall just to ensure that the program's working. Hopefully that makes sense.
Mm-hmm. So it sounds like it would be nice if there was funding to actually track that and find some way within different collaborations to track that. What I am hearing from you, though, Sandy, is that at least people are getting connected to services.
Right, and that was really our goal, is to get get students connected. We do not have the infrastructure to continue tracking at that point.
Yeah. Okay. All right. And what about growing and sustaining a collaboration from your end, Sandy?
Well, we were certainly we were able to manage that a little bit better when we had our student mental health grant in the Chancellor's office, which was the last couple of years, and so we used the regional strategizing forums as a way to maintain these relationships and help sustain the relationships. This is the first year that we're not funded to do that. We are still planning to try to have some kind of a meeting, maybe luncheon. I'm still working on trying to find out if I have the funding to do that before the end of the semester or sometime in the early summer to try to bring people back together. But we found that bringing our community partners together maybe once a semester or once a year was a really nice way to kind of keep the relationship going, find out if there are new people, if staff has changed, update our paperwork, and our numbers and all of that. So that's a little bit more of a challenge for this year, but we're still hoping to be able to do that.
Great.
So.
Janine?
Well, I think that's kind of what I was just mentioning out in our desert region, that regional collaborative meeting that continues to happen, I think, has really been key to sustaining the relationships and growing opportunities for students to have access to additional services. I know that it was as a result of those meetings that we, our department made the decision to add a psychiatrist to our staff to be able to assist more of the students on that particular campus. So there's positive outcomes from those relationships.
Great.
And I just want to say, Sally, really quickly that there is a regional meeting also, or service area meeting, in our area as well, that when we are able to attend from our end, we get a lot of good information and are able to build new relationships. It's just difficult for us to get to those meetings because of our limited staff, limited time and all that, but we do try to go to those meetings as often as possible.
All right. And I think you also have relationships with other providers that either they're not part of the county, but sometimes they get county money. And I think you had said you had somebody that comes on campus or has for a long time to do substance abuse assessments and treatment referrals.
Right. We have an agency, D.D. Hirsch, Community Mental Health Agency. They have a alcohol and drug prevention program, and they they sort of co-locate on our campus. So they have a mental health worker who comes on our campus and will both do workshops and training, and also will see students as well. And so we have somebody that comes maybe for half a day of a week during the week to see students. And then we also have an agency nearby, Family Services of Santa Monica. They also have some kind of a grant that allows them to do field work. And so they also come on campus, and we can make these direct referrals to them, and the student does not have to go off campus. So those two are really helpful. The challenge is space, but we've been able to manage that so far. But to be able to have somebody on our campus that we can refer directly to allows, facilitates that referral. It's so much easier. And we also know that the student at that point is following through and getting their needs met. So, so those two agencies have been on the campus even before the student mental health grant. So that's been helpful. And we also have other agencies we work with, like our U.S. Vets, a rape treatment center here in Santa Monica, and some of our colleges, local colleges and universities that have graduate programs. they have clinics, and they don't come on our campus, but we can also refer students to their clinics.
Right. And it sounded like you had a great mental health and wellness event last year that included a lot of your partner agencies coming on and doing presentations and different things as well.
Right. We have our health and mental health, on our quad fair. It's like a fair. And we invite all of our agencies to that, and many of them, do participate. So that is another way that we stay in contact.
Great. And Janine, you said that your folks also go out and do lots of educational things for college staff and faculty and students as well?
Yes. So we've been invited to do, and I can't remember the term, the college, Sandy probably knows, but apparently faculty need to receive CEs each year.
Oh, yeah.
It's like
continuing education.
Like flex hours. They're called.
Yeah, there we go, for flex hours, right. So we've been invited to go and do presentations to staff on just awareness about mental health, signs and symptoms, and stigma as a part of that requirement, which has been a nice opportunity for us. And then whether it's a college offering a health fair, just as you described, Sandy, we've been invited, and I try to rally as many of the local program people, not just the department, because we have limited resources, but other community providers to come as well. And then the Active Minds chapters, they do, the students themselves organize health and wellness events on the campuses that they invite us to attend as well.
Okay. So what I like is that you've both given examples of collaborations all across the continuum of care, from wellness to early intervention and actual treatment and referral, which is great. There are a couple other questions that came in. So even though there's not funding to actually track student outcomes directly tied to their treatment, are you either of you able to track if they're still on campus and matriculating through their classes?
I can say from our perspective, no, we are not able to track whether
they're got services and actually matriculated.
Right. To connect that. We have a separate system of tracking our cases, and it's not connected to the larger college system. So that's difficult for us to track.
Okay, and I would imagine if they got services elsewhere, unless the student authorizes the provider to share any kind of information with you, you would access which students got services and tie that to their academic record.
Yeah, that's a challenge there.
Yeah. And then another question, I guess this is for you, Sandy. What data was used to show the need for mental health services on campus? Did you have your own assessment tool? Did you get direct data from your campus?
I wish it was that sophisticated. The data was really the demand in our office. So we had such a wait list that developed develops every year in our office of students who want services and we're not able to provide the services, that we needed to find a way to make sure that students who were asking for services were able to be seen. And what we try to see every student that asks, that wants services, at least to assess what their needs are. But in terms of time and staff time to actually work with students, it's really difficult. So again, it's totally unsophisticated data collection, but we knew pretty quickly that we weren't going to be able to meet the demand in our office.
It sounds like just to even get funding for your own department, you use that data to help make the case for getting more support from your college.
Right. That's how we were able to get some support for our postdoctoral interns, which we have full-time, and we're able to pay them a stipend, which is not a lot of money for them, but it's something, and they get their hours, and that's really our staff, is our postdocs. So we were able to show, we have this many 30 students waiting, and we haven't been able to get to, and we need more staff.
And would you be able to refer out any of those students on the wait list?
Yes. We stay in contact with the students on the wait list, call them every week to let them know where we are in the process. We invite them to come in for walk-in. We have some walk-in/crisis hours every day. We invite them to come in so that we can at least do some initial assessment. So if they're willing, we will see them, even if it's for a shorter period of time than a regular 50-minute session, just to make some kind of assessment of their needs.
Okay. And do either of you have any advice for community colleges that don't have a mental health department or anybody on campus that can actually provide mental health services in terms of collecting data to show the need for those services on campus for health centers or any other entity on campus that would like to try and persuade their campus to allow them to set up some type of on-campus mental health services? Any advice on how to get data that demonstrates need?
I think that most campuses have some kind of health services, is my understanding, and I'm sure that's where they're going to see, the students in need. So, somehow finding a way to track those students. Also, the academic counselors they see and hear all kinds of stories from students, and they are probably the group on our campus that refer the most to our office. And so if there was a way for them to track their students, then I think that information could be used.
Okay, that's good. Great. Thank you. Okay. And what advice do either of you have to give other colleges and county behavioral and mental health departments interested in developing similar collaborations or activities that were successful for both of you? So, Janine, do you want to respond to that one first?
Sure. I think that we've probably beat this one a little bit to death, but it's really important to be patient and persistent. And don't assume that the folks that you're reaching out to don't care or that it's not important, but that it's just a matter of, at that moment, of priority. Another thing that I think is really important that I've talked about, which I'm glad made it into the toolkit, is it's important not to approach our county behavioral health or mental health department with a request for funding the first time you meet them. I think it's important that relationship be built first. So coming in with information about what your campus needs are, particularly around, obviously around the students, but also maybe around faculty needs as well, whether that be training or other supports that might be helpful. And just go to that meeting with an open ear as to what the behavioral health or mental health department does have to offer. So, I think it's important for the colleges to know that every county has prevention and early intervention dollars. It doesn't mean that they're going to come directly to your campus, but you do want to be aware of what programs and services are that you may be able to connect your students to, whether that's through referral or to invite those providers onto campus. All counties also have workforce education and training departments that can come on campus and help support your efforts to make sure your staff and faculty are aware of mental health signs and symptoms and other diagnoses. I think that it's really important to have a snapshot of what I found it as a behavioral health department. I found it incredibly helpful and powerful to have a snapshot of what your campus looks like. So how many students are served? What does your demographic look like? What does the cultural diversity look like? What sorts of, and it may be something you have actual data, or it could be anecdotal data on the mental health needs of the students on your campus. So just coming in with information, I think, is helpful, because what I did, knowing our system, then I could use my knowledge to plug in what resources may be helpful to the college. And vice versa. I certainly have learned a great deal about what a college system looks like, but I am no expert by any means, and I still need to ask questions about the difference. Do you have a health center? Do you have counseling services? Is it academic counseling? So just being patient with your behavioral health partners too. And the other thing I would, as I mentioned before, I would just advocate, and I know, Sandy, I understand completely that time factor, but any opportunity you have to make yourself visible at any of the standing committees or planning meetings, to do that, it really shows commitment.
Mm-hmm. Mm-hmm.
That's great. And Janine, really quickly, does the College of the Desert and Coachella Valley, does that fall in Riverside County?
Yes. In fact, College of the Desert is the campus I was referring to that continues to hold kind of regional meetings.
Okay, great. Because you may be hearing from somebody on the webinar now from there. So,
good.
Sandy, any advice that you would give to anybody?
I think, Janine, I certainly agree with everything Janine is saying in terms of persistence. We can't say that enough. I think as a college. Hello? What happened?
I don't know.
Okay.
There we go.
Oh, no.
Is that us?
All guests have been muted. You can unmute your line by pressing *6.
Hello?
Hello? Are we there?
I think we're still here. Okay.
Oh, that was interesting.
That was, yeah.
That happens.
Okay.
All right.
So,
I'm sorry, Sandy. Go ahead.
That's okay. So, of course, the persistence is important. I think finding out, you have to take some time to find out who's in your community and what is the expertise in the community. And that it does take time, but it's important. And then inviting folks in to do presentations, some of what Janine was talking about, but really trying to understand what agencies and organizations are in your community, and most of the time they are looking for, where they can be helpful. So they're always willing to come on campus and provide some kind of service or some kind of training. And I don't even think I have anything else to add. I think the service area meetings are important, and it really takes, I think, a concerted effort something that you're on, put on your calendar regularly that you need to check in, you know, with your community partners so that you know what's going on.
Okay, great, thank you. So we have a couple questions. Janine, I know because you weren't able to log on, you can't see anything in any of the questions coming through in the chat box. So the person from the College of the Desert in Coachella Valley would like to know what is the best number to call you.
Okay, you ready? 951-955.
All right, hang on. I'm going to type this into the chat box, too. 951
955
955
7125.
7125. Okay, great. All right, and Sandy, I've got one other question for you. Do you provide a certain number for counseling sessions for your students so you can go through the wait list more quickly?
Yes, we do. We don't advertise a number because what we don't want is for students to come in saying, you said I get 5 sessions and so I want my 5 sessions. Because we feel like that's a decision that we have to make based on what we see as their needs. But on average, we see students anywhere from 1 to about 5 or 6 sessions at the most. And so maybe 3 is the norm for us, and we certainly would like to see students longer, but we're not able to, and that at least allows us to see as many students as we possibly can, given the staff hours.
Great, thank you. And then Janine, in terms of actually receiving treatment services from the county, I think most counties, and correct me if I'm wrong, there also is some eligibility criteria that's tied to income and symptom severity, correct?
You are right. You are right. And I think it may vary county to county, depending on a variety of circumstances and challenges. You know, I certainly am not here to say that we are able to serve every referral that we get. We actually, as a county Department of Mental Health, are fairly limited, serving those with serious and persistent mental illness. But we do have partners that we do our best to connect folks to, whether that's prevention and early intervention services or more long-term treatment.
Okay, great.
But you bring up a good point. I mean, we have to be realistic about the resources that are available.
Mm-hmm. And I know that in some counties there are also several peer support types of programs that are available and may be helpful to some students as well.
Right. Yes, absolutely.
All right. All right. Any other questions? All right, Carrie, next slide, please. Okay, so the final section of the toolkit is the appendix, and because there are lots and lots of acronyms and terms that are unique to county mental and behavioral health departments as well as the community college system, the toolkit decodes all of that for you. There are also other mental health resources online that we've provided, a sample community college organizational chart that gives you at least a high-level general idea of that structure for those from the mental health departments. And in order to help in your own planning process, should you decide to try and set up a collaboration in your community, we've provided a mental health services checklist. So you can use it to check off what you need, what you have, and then some worksheets to help you in planning as you identify potential collaboration partners and to help you plan for that crucial initial meeting. All right, next slide. And we would very much like to thank you for taking time out of your busy day to join us on the webinar. And special thanks to Betsy and Carrie and Sandra Rowe and Janine Moore for their time, and particularly Sandra and Janine for sharing their experience and their expertise. If you haven't accessed the toolkit, here's how to do that. And I believe, Carrie, that this is the last slide, yes?
Yep, last one.
Yep, one more. All right, so if you want to find out more about student mental health program and resources, here's the website, and that will also provide you some information about the toolkit and how to download it. And if you have any other questions, feel free to get in charge with us at the contact information provided here. And Carrie, I believe I'm going to turn it back over to you now to close out and with evaluation instructions.
Sure. Thank you. Thank you, everybody, for taking the time to participate on this session today. And a big thank you to Sally Jew, Sandra Rowe, and Janine Moore for providing this important information on creating effective collaborations between colleges, county mental health departments, and other mental health providers. As you begin to log off and close out of the webinar, there will be a short evaluation form that will pop up on your computer screen. Just take a moment to complete it, provide us with your feedback. Your responses do help us improve these sessions for the future. So again, thank you for joining today, and have a wonderful rest of your day. Thanks, everybody.
Thank you, everyone. Bye.
Bye-bye.
Bye-bye.
Thank you.